Another problem that we have is the management of COPD. So, okay, fine, we diagnose patients with COPD. Now what do we do? So most disease management programs, what they actually focus on is treatment, and is medications and drugs. So you get your medications, you get your inhalers, you get your pills, and you have to take it on a regular basis. Well, that's not the only thing that you need to be doing to address COPD. With that, you may feel a little bit better, but that's not going to be enough. On average, every patient with COPD has 5 other conditions, depression being one of the most important ones. This is a little bit about remember at the beginning I was telling you about the burden of COPD in the country? Well, let me show you some of these numbers again. This is basically the general population, more or less the cost associated with treating the general population. Over here we have 3,436. I'm sorry, you cannot see very well the numbers in the back. Those numbers are for hospitalizations. These are actually costs outside with other health costs, mainly emergency rooms and urgency visits. And these are outpatient costs. Most of the cost goes to hospitalization, meaning that those patients are getting into the hospitals to be treated in the hospitals. What we want to do is to prevent that. We want to prevent people getting sick, and we want to prevent that they need hospitalizations. We want to be able to treat them outside of the hospital. Why? Because you go into the hospital, you need it, but then there is a high risk that you will develop some other infections when you are in the hospitals. Most of the costs associated with this is the hospitals. So we need to address something to keep our COPD patients outside of the hospitals, not inside of the hospitals. And we have to address that issue. These are all the things that we should be thinking when we think of COPD. It's not only this, it's not only medication use. These are the things that we need to be thinking about. Exposure, think about the smoking cessation, and I think this has been proven the most important thing that any individual can do to improve their health is a smoking cessation if they smoke. Not only for COPD, but for many other diseases. But for COPD, it's estimated that 85 to 90% of the people who have COPD is because they smoked at one point in their life. However, only 15% of the people that smoke develop COPD. Why is that? I will talk about that later. Patient education. Again, if you don't know what COPD is, you won't even know how to address it. If you have already been diagnosed with COPD, but you don't know about these other alternatives that you have, you will not get better. Because yes, you can deal with your medications, but those of you who are taking medications here you were not lying to me, I will tell you that you don't know very well how to use many of the medications. How many of you have seen House, the show, TV show? Well, that's actually funny because actually what you saw in House, and I don't know if you saw this episode, it was this House is asking one of his patients, is actually, do you use an inhaler? And the patient is, of course I'm using my inhaler all the time. Okay, how are you using it? And then the patient goes, chick, 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 chick. Well, it's going to my lungs, isn't it? Actually, another thing with the COPD Foundation, I will tell you, we have a mobile spirometry unit that goes around the country, and we had another patient. How are you using your inhaler? And she goes, chick, chick. Well, it's going to my lungs, right? So people don't really know how to use the inhalers. And adherence to treatment, how do you keep doing that? If you're doing it right, it's a big issue. Most people don't know how to use their inhalers. So if they don't know how to use their inhalers, they will not get better. So we need to educate our patients. Most physicians won't do that. Most physicians will tell you, here's your prescription, see you. Come back in 1 month. Come back in 6 months. That's it. We have to do more than that. But that's why we have different healthcare professionals. That's why we have different organizations. Let's use them. That's why we have the American Lung Association, we have the respiratory therapists, the physician assistants, we have the nurses. We have so many people that can help. But if we don't educate the patients, they will not get better. They will continue going to the hospitals and they will continue to die. Pulmonary rehab, as I told you. Most people will think that because they cannot breathe, they shouldn't go and do exercise. Well, it's the opposite. You need to learn how you can breathe better. You need to get better. You need to go out and walk. You have to improve you have to increase exercise. You need to get better. You need to have strong muscles so you can breathe. People just think that, oh, I don't feel like going out. I'm really sick. I'm short of breath. Well, because of that, you have to go out there and exercise and use pulmonary rehab to help you. So do that. Oxygen therapy. That's another issue. Most physicians don't even know how to manage COPD, and they don't even know how to manage oxygen. And that's an issue. And that's an issue for you, because we understand the problems. We know what is to travel with oxygen. That's a big issue. That's why we have some companies today probably that are providing oxygen services. Because we have to help the people. We have to deal with this. Let's try to see how we can get better with the oxygen. But you need to know how to use the oxygen. Oxygen is a medication. If you don't use it well, you can get sick because you don't use very well the oxygen. So you have to be careful. There are people who actually smoke around oxygen cylinders. They don't know that they shouldn't be doing that. But again, it's about education. Vaccination. You need to prevent. You need to get your flu vaccines. Some people don't even know. Most people think that if you get the vaccine, you're going to get sick. That's when most people will think, oh, I don't know. I don't know about those vaccines. I think every time that I get a shot, I get sick. That's when more people, but that's not true. And especially for you COPD patients, you need to get vaccinated. You need to be careful because this could kill you. Disease management programs has different ways to address patients. You have educational brochures, you have audio tapes, and you have support groups, you have home visits, exercise programs, action plans. There are many things that you can do. And you have to use and you have to learn what you have in your community, and you have to go and do all those things. Use what you have in the community, take action, don't stay home, find alternatives, go to the Better Breathers groups, go and talk to the people in the American Lung Association to see what other programs they are doing. Partner with your physician, partner with your hospital, find alternatives to manage your COPD. This is, and a study actually showed that by doing disease management programs, we were able to lower hospital admissions for acute exacerbations. We were able to decrease ER visits, and we were able to decrease unscheduled physician visits. So by doing all those things that I told you, there has been studies that have shown improvement. So again, it's not only medication, it's doing multiple things. By doing all those things, you will be feeling better and you will stay out of the hospitals. In a recent review of a study that it was conducted, the overall disease management plans have a positive effect on the quality of life. Now, this is the issue for those of you who have lung disease. You need a better quality of life. Don't settle. Don't think that because you're sick, let's just deal with this. You have to get better. You can get better. Yes, there is no way for you already have COPD, to get your lungs back because you already have COPD. But you can feel better. It's about quality of life. It's about how you cope with other people and this is not a disease for you. This is a disease for the people around you. Most of you probably are with your family members and with your loved ones today. Ask your loved ones. It's a difficult burden for all of them. So get better. Work with your family members. Work with your loved ones. Learn about all these things so you can improve your quality of life and you can feel happy.